हेलो गुड मॉर्निंग। मैं आपसे डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के पास्ट ईयर क्वेश्चन पेपर। पल्सस पैराडॉक्स इज सीन इन सीवियर अस्थमा और क्रोनिक ऑब्स्ट्रक्टिव pulmonary disease. Here the answer will be because during severe asthma attacks or exacerbation of COPD, airway resistance increase significantly during inspiration. This leads to increased negative intrathoracic pressure and affecting venous return to the heart and causing a drop in systolic blood pressure during the inspiration. Next question. A 19-year-old male chronic smoker presented with fever, a painful lump over his left cheek just below the ear, and difficulty in swearing or talking. The patient also complained of mild testicular pain. What is the most likely diagnosis? Mild testicular pain is the mumps is the answer because based on the symptom describe the most likely diagnosis for this 19-year-old male with fever or painful lump below a left ear, difficulty swallowing or talking, and mild testicular pain is a what? Parotitis and orchitis due to mumps. Next question. A 20-year-old male presented with a 11-week history of yellow skin and sclera but is otherwise asymptomatic. He gives a history of viral infection of 10 days back. There is a history of similar episode of icterus 2 years back of a period of 2 weeks. On further question, he had that he used to have a long basketball practice hours 2 years back and he used to be physically drained during that period. The current serum bilirubin is 2.4, unconjugated 2.1 and conjugated bilirubin 0.3, serum AST and ALT level normal. Which of the following is the most likely diagnosis? Here the most likely diagnosis is the Gilbert syndrome because in the above patient there is a presence of mild jaundice and it occurs under the what stressful circumstance. There is also an increase in unconjugated bilirubin where is the AST and ALT levels are normal, which leads to the most probable diagnosis of Gilbert syndrome. In Dubny-Johnson syndrome has conjugated hyperbilirubinemia and brown-black melanin-like deposition in on liver. In Crigler-Najjar type 1 syndrome, here the present with keratinitis and neurological connectors and neurological damage in babies. In Rotary is similar to Dubny-Johnson syndrome, but the presentation is mild and there is increased conjugated bilirubin, and the liver does not have black colored deposit. Next question. A 30-year-old man present with excessive fatigability towards the end of the day that improved with rest. He also gives a history of patosi, difficulty in speech and swearing. What is the most likely diagnosis? Myasthenia gravis, Lambert-Eaton syndrome, Duchenne muscular dystrophy, and systemic lupus erythematosus. Here the myasthenia gravis is the answer because in the above case the most probable diagnosis what that is the myasthenia gravis as is present what easy fatigability towards the end of the day that improves with the rest and also has a history of patosis, difficulty in speech, swallowing. It is due to the autoantibody mediated destruction of acetylcholine receptor at the postsynaptic membrane. This consequently leads to a decreased transmission at the neuromuscular junction. Failure of transmission result in muscle weakness. Next question. Blast lung is also known as what? ARDS because the blast lung is closely associated with ARDS, acute respiratory distress syndrome. ARDS is a severe lung condition that can occur after trauma, including blast injury. It is characterized by the sudden onset of severe respiratory distress with symptoms such as difficulty breathing, rapid breathing, and low oxygen level. ARDS can be caused by various factors, including trauma, sepsis, pneumonia, or inhalation of harmful substance. Next question. A tall male present with absent pubic and axillary hair, infantile genitalia, high FH and FSH level with XSY karyotype. What is the most probably diagnosis of the Klinefelter syndrome? Because the based on the provided information, the most probable diagnosis for the tall male with absent pubic and axillary hair, infantile genitalia, high LH and FSH levels, and the XSY karyotype is Klinefelter syndrome. What is the Klinefelter syndrome? It's a genetic disorder characterized by the presence of an extra X chromosome in male. Extra X chromosomes in males, with the resulting in a karyotype of XXY instead of the usual XY. It typically leads to various physical and developmental features include tall stature, small testes, infantile genitalia, and developed secondary sexual characteristics. That's all. Thank you and keep watching.